Hey everyone, it's Wednesday, time for Wisdom Wednesday. Thought I would do a little sort of ask me anything at AMA that I've seen an awful lot on many podcasts. Had several people asking questions this week, so I thought I'd cover 2 or 3 different topics. And the first one being the semaglutide, what we're using, the GLP-1 agonist, receptor agonist that we've been using for weight loss, and people wondering how are things going. Well, I'll tell you, people are losing weight really well, and we have found that the side effects have been minimal and folks have done exceedingly well, just slowly ramping up the dose. And this is a subcutaneous once-a-week injection. The mechanism of action is that it really does make a huge difference in just how we function and manage to handle glucose in the body, as well as reduce insulin resistance and increase insulin sensitivity. It changes just lipolysis all over the body and how we can go into fat stores and break that down. It also helps decrease appetite, improve satiety. People really say that they're just not hungry. Some people, to the extent that they're actually making themselves eat and are spreading out the dosing just so that we're definitely getting some nutrition, which is very important too, because we want to make sure that over the long haul, this is not a huge, fast weight loss, but a slow, steady type of weight loss so that it is sustainable, so that when you have completely gotten to your goal weight, that we see you're able to maintain and find a sustainable way to keep your weight off. And we are using this also as far as maintenance. We'll be doing a once-a-month injection for folks for a while until we can really see sustainable maintenance of that weight loss, because the recidivism or the weight gain coming back after weight loss is very high on any weight loss program. So we just want to make sure that this is sustainable for all folks. So the semaglutide has been quite well received, and folks are doing very well on this particular program. And we've found that whether you've got 45 pounds to lose or 10 pounds to lose, it's working well. So that's semaglutide. Then the next thing that's kind of come to the surface recently is what can we do with what we have available today for female pattern hair loss. And we're starting to see in the dermatologic literature use of low-dose oral minoxidil. I know in the past we've talked about low-dose naltrexone, but low-dose oral minoxidil. We know that there is the minoxidil in the mousse and the topical type products that are available for male pattern baldness and for any of the alopecias that are out there. But we are starting to see a little bit of some response in women as well. It's a very low dose. The lowest dose that minoxidil comes in is 2.5 milligrams. The side effects is that it can lower blood pressure. That was originally one of the mechanisms of action of this particular drug was to lower blood pressure. So even in low dose, you can see a little hypotension, so you have to be aware of that. But with women, you take a 2.5 milligram tablet and cut it into fourths and start at a 0.625, either once a day for a while, or you can bump it up to twice a day. But usually those low doses in and around that 1 milligram dosing tends to be as effective if it's going to work. And of course, these things take time, but it does tend to increase the anagen phase, which is the growth phase of hair, and reduces that telogen phase or that resting phase, so that we have more hair in the growing phases. And we've seen that also with spermidine. It increases that anagen phase, and spermidine also raises and increases the amount of keratin per hair follicle. So that in and of itself, we've got now another tool besides the spermidine, and we've got a little hair kit here. But also, if we need to do more, we can look into the low-dose oral minoxidil. And then lastly, I've had someone ask recently, what should we do about this vaccine that's coming out? And we now have this bivalent vaccine that has been sort of targeting the Omicron variant, but there seems to be a new variant that is coming out, the XBB variant, that's very infectious. And so it's really hard to know. I think it's going to end up being kind of like the flu. There's going to be so many different types of viruses out there as far as the variants are concerned. So having good antibodies is always going to be beneficial. It does not appear that with some of these newer variants, the antibody treatments are as effective. But we do see that folks who have had COVID and who have been vaccinated, there is over time reduction in terms of serious illness. Fortunately, the hospitals are not as overwhelmed, but it's still possible to have serious illness. So if you were thinking about getting this next vaccine booster, the jury's still out. We really don't know how this is going to work as far as, certainly not from a prevention standpoint, and we've seen that with the vaccine already, that we are seeing just significant reduction in severe disease. But we also see a lot of folks with long COVID. We're seeing a lot of folks that are having issues having had the vaccine and post-vaccine type illnesses and issues with that spike protein. So I would suggest that if you are really high risk, that perhaps this is something you might want to consider, or if you want, you certainly can come by and see what your antibody titers look like to determine whether or not your antibody titers are high enough and that you might do well. But understand that none of these vaccines to date are preventative in terms of disease. And so at this stage, there's little we know about this new variant to really help you figure out whether or not this is a booster that you want to look into or not. And if any of you want to come and check your antibody titers, I think that would be great. I do believe that for really high risk people, that's what these types of boosters are really going to help take care of. And what we're seeing is that the concern is that, can we get rid of this particular virus if we just all get this? And I do not think that that's really feasible at this point with what we're seeing across the world. And so I think you just have to go with your gut as far as what your experience has been thus far in these last 2.5, almost 3 years now. But just know that this new vaccine is for an old variant, for 2 old variants of the Omicron that are now seemingly going down, and which is great. We have lower levels of that. We are starting to see high flu levels going up real quickly. They're a lot sooner this year. So just know that illnesses right now may just as easily be flu as well as it could be COVID. So hopefully that's helped you a little bit. At this stage, we just really don't know with this bivalent booster and with the new variants how effective it's going to be. So just as a reminder, the main thing with any of the cold and flu and coronaviruses out there, the main thing is, again, to optimize your immune system. So I didn't want to forget that in terms of just making sure you have good, healthy vitamin D levels, that you are eating in a way that is less inflammatory. We are getting ready to really enter the cold and flu season. So watching your sugars, it's no wonder we see so much illness in and around the holidays when we are really off, sort of getting off our normal routine as far as how we eat nutritionally and trying to limit the inflammatory foods. So, and make sure you're getting plenty of sleep and maintaining exercise. So these are things that really make a difference in terms of just our overall ability to manage any of these viruses that we come in contact with and might be subjected to having some type of illness. So just make sure that you're doing all that you can to keep your immune system in a good place as we move into the fall and winter months. So just wanted to share that with you. If there's any questions or concerns as patients, feel free to give us a call. Be happy to help you in any way that I can. And we look forward to visiting again next week. You all have a great week and a happy Wednesday to you.